Alright guys, week 4, digestive system. So I hope you're excited and ready for this. A couple housekeeping items just to go over. I'll have a feedback video for you guys probably tomorrow morning, but I just wanted to quickly go over a couple of things. Make sure you're paying attention to spelling. It counts. I've said that a few times, but here's an example of pylo and then spelled philo. So this would be marked wrong, even though clearly you have an understanding of the subject. Your spelling is incorrect. Make sure you write things in combining form. So if it's asking for a combining form for skin, you're writing dermat \o and not dermato. If you write this second way, it'll be marked wrong. That's incorrect. If it's asking for a root word, of course you would just write dermat, D-E-R-M-A-T, and not have the O there. And if it asks for what is the medical term for inflammation of the skin, you would write dermatitis, no backslashes, no anything, no O, because the suffix ends with a vowel. So make sure you're paying attention to your formatting. Again, xeno, not xeno. You don't need any parentheses, you don't need any explanations. You just need to write the words in the format that they ask you to give them. And make sure you're watching these lectures, they'll give you hints. This week is about the digestive system, and it's largely about anatomy, so that's why I posted a lot of pictures in this video, in this slideshow, just so you can see that. But here is the anatomy we're going to talk about. I think if you print something out like this, get an anatomy textbook, it will help you to understand what we're talking about, kind of how all this goes together. And again, here is this is from your book actually. This shows the pathway of food as far as the digestive system goes and how it kind of comes together. So I think that this is a good diagram as well. We'll start in the mouth, right? Mouth is known as oral or stomato. Oral, right? You hear this, your oral hygiene, or stomatodynia. So that is the mouth. Remember, any words that have two root words, they're going to like to test you and quiz you about. So they're going to say, all of these mean mouth, except for what? And then you got to mark the ones that mean mouth. If you don't mark both of these, you're going to miss points, okay? Inside of our mouth, we have salivary glands, silo, right? Siloectasis, right? And this is what we call a sialogram. Sialogram, right here you can see they've injected dye. They're now taking x-rays to see what the salivary glands look like. You can also get stones in these, which is silolithiasis, and where we get little stones in here, which would cause this, the siloectasis, which would be this enlargement of the salivary gland. So I just wanted to show you here how you've got a root word, and then you've got this suffix, you've got this suffix with a combining form, and you've got this suffix with a combining form. How one root word can be changed by just the suffix or the prefix that we put on there. Inside of our mouth, of course, we have our tongue. Again, two words mean tongue, glossal or lingual, right? So you have to be aware of these two and be cognizant of them. Of course, you have your glossopharyngeal nerve, all right? So this is two root words together, the tongue and the pharynx, right? So this is a nerve that goes to the tongue and the pharynx, right? And here, glossectomy, excision of the tongue, lingual, and so that has to do with our tongue, right? And here we have a microcytic inflammatory process of the tongue, right? And so this is just showing you some pathology. This is treated with carbon dioxide lasers to break down this microcytic disease, and then you can see afterwards the tongue getting more normal. Your cheek, right, is your buccal. So here's your long buccal buccal or buccal nerve, right? And this is the one your dentist numbs up in the back of your mouth, right back in here. When he wants to do that injection, you can see he's kind of making that nerve more pronounced there. And so this is the one he numbs up when he's going to work back here on these molars. So lip, again, two words, chyleo and labio, right? And chylosis, right? That's what this is. That's what this picture is right here. This is chylosis, an abnormal condition of the lips, right? And labial is more commonly associated with the lips of the vagina, but you can get disease down there, and we'll talk more about that in reproductive systems. So your teeth, right? Your dent or your odonto, right? So orthodontist, right? Ortho, something straight. Odontos, show straight teeth. And dentist is somebody who studies and treats the teeth. Here we have the esophagus, right? Esophagio, esophagodynia, esophagalgia, esophageospasm, esophagostenosis. So this here is esophageal varices. This is somebody who has portal hypertension, which is a high pressure of the veins coming out of the liver, which filters your blood, and when that backs up, you get this esophageal varices. These can rupture and bleed a lot, so this is a pretty serious condition. This is a endoscopy where they're utilizing that scope to diagnose the condition, right? So esophagus, make sure you know esophagus. Your pharynx, right? Here's pharyngitis. Almost everybody's had this, right? Strep throat, kind of pharyngitis, but you can see the redness here with the little white spots. So this is pharyngitis. Then our next thing is our stomach, right? And here, you know, gastro is stomach, gastritis, gastrodynia, gastralgia, gastropathy. Here's a procedure they do of the gastric sleeve, and this is gastric bypass. Right, so these are two ways to treat obesity surgically. Here's a sleeve where they remove a portion of the stomach, and here's the bypass where they actually bypass the stomach into the duodenum right here, which is the first section of the small intestine. So two different ways. It helps you see your anatomy and how your terms come together. So here's our small intestine, right? Which in general, small intestine's intro, so enteritis, enteropathy, enterocolitis, enterocelli, and here's the enterocelli where you can see this herniation of the small bowel down into the vagina right here, and so this would be enterocelli, where celli is this herniation or this outpouching. You can also have proctocelli, rectocelli, where these organs get pouched into other parts, and it's usually a herniation, right? In the small intestine, you got three areas. You got the duodenum, that's the first part, the jejunum, and the ileum, right? So you can have disease in each of those parts. You can also have removal, like you could have jejunectomy, where they remove the middle portion of your small intestine. So make sure you're understanding. Entero is this kind of global, that's the small intestine, and then inside of that small intestine, there's smaller parts. There's the jejunum, duodenum, the jejunum, and the ileum. So make sure you're familiar with that with your anatomy. Your large intestine, here it is right here. It kind of wraps around the small intestine, and it's colo or colonal, right? And so make sure you're familiar with that. Colitis, colorectal, colpitosis, and then, you know, you have different portions of this large intestine. Again, the sigmoid portion, appendix, sorry, thinking of appendectomy, right, is what we do to take this out, but appendicitis is inflammation of the appendix, which hangs kind of off of the large bowel here. So make sure you're familiar with these terms as well. So terminal or end of the large intestine is your recto or your procto, right? And that's down here in this area. You can see it here. Here's the rectum. And then, of course, the very end is your anus, right? And so you can have, again, proctoplagia, proctoparalysis, rectocelli. So you can combine these terms with multiple prefixes, suffixes, and get different terms. And that's what the nature of this course is, making sure you understand those. So that's kind of the path. Now, the organs that kind of support the digestive system, of course, your liver, hepatoma, hepatoma, or hepatomegaly, right? So this is our liver, right? And you can have different conditions there. This is obviously growth of the liver, and this is enlargement of the liver. So here's our liver. It kind of supports things. The other things are pancreas. You can see that little yellow guy that sits right down there. All right, and this supports you have secretion of insulin and other hormones from your pancreas, and so there's that. And then of course your gallbladder sits here underneath the liver, and you need to understand the different parts of the gallbladder. It's a little confusing, but cholecysto is the gallbladder in general. So if you have cholecystitis, you have inflammation of that gallbladder. Cholangial is the bile vessel, right? So when we do a cholangiogram, we're actually going to shoot dye into that vessel, but put an x-ray on it and watch to see if that vessel is clogged or if it has an obstruction, if it has a stone in it. That's what we're going to be watching for. And then, of course, chole by itself is just bile or gall, and that's what sits inside of the bile duct, right? So a cholelith, right, that's a stone, a gallstone, right, which is a stone that sits inside of that gallbladder. Now, choledocho, right, that's the bile duct. That's where the duct where the bile, the chole, gets stored inside the gallbladder, and then it gets secreted through the duct, which is choledocho. So sometimes if somebody says you have choledocholithiasis, you have a stone in the duct blocking the movement of bile out of the gallbladder and into the duodenum where it gets secreted to help with digestion. So choledocholithiasis, but you could have cholecystolithiasis. You could have a cholelith in the gallbladder. So you can see how these can kind of be moved around. But understanding these different terms will be important for your assignment this week. So here's my spiritual thought. A lot of it is based off of a conference that I watched this last week. And I was reading Jesus the Christ this morning, and I came across Elder Talmadge talking about the parables that Jesus taught, and several of them had to do with seeds and the idea that things start out as a seed. And he made a very interesting point. I thought he said that what Jesus was teaching is that it wasn't the seed that was important, but it was the potential that the seed had to grow and to develop into a tree or whatever it was going to grow, in wheat in some cases. But that seed has unlimited potential to reach its maximum height of its creation. And so I ask you, as I was thinking about that, I ask you guys, do you believe that your potential is unlimited? You're like a seed. I'm like a seed. Do we believe that God will make the most out of the seed that we have, and that we can reach the highest potential? Our potential is unlimited. Unlike a tree or a plant, we are His children. We can be like Him. We can do the things He wants. It's truly unlimited. Do we believe that He is all-knowing? Something I took from conference, that Elder Rasban, that do you believe that He knows all things, that He'll put you on the path so that your seed can truly develop, truly flourish, that you can become all that you can? Do you know and trust that? Do you have faith that even when things aren't going right, that if you trust in God, that He will turn that path, help you make that path to become the person that He knows you can be? Are you willing to follow that path, even when it gets tough? One thing I heard multiple general authorities say this weekend was, we're not always in control of what happens. Sometimes divorce comes into our lives. Sometimes family troubles come into our life, death, grief. We're not always in control of that, but we are in control of how we respond to the things that happen in our lives. Our agency is in complete go when it comes to how we respond. So do we remain faithful and patient? I love that story. I wish I could remember who said it. He talked about somebody he knew who had struggled with their testimony for years and years. And finally she was in the temple, and while she's in the temple, she had this spiritual experience. But it had been years. Are we willing to remain faithful for many years? I bear testimony that you are God's children, that your potential is unlimited, your ability to learn and grow is unlimited, and I hope you have a wonderful week. Thank you.